The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Today is Friday, September 30th. I'm Donna Will, Professional Development Coordinator for the Central Maryland Regional Office of the Maryland Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary, McCall Thornton, MDH Nurse Consultant with the Center for Immunization Prevention and Health Promotion Administration. We also have Rhonda Workman, Director of Programs, Jennifer Mettrick, DDA QIO with Liberty Healthcare Corporation. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. And if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel box. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. Now I'd like to introduce Deputy Secretary Bernie Simons. Good afternoon.
Good afternoon. Can you hear me okay, Donna?
Yes.
Okay, good. Thank you. So I want to thank everybody for joining us today. I mean, this is DDA's September 2022 webinar. And, I look forward to these every month and, getting your input and receiving feedback. And I want to thank everybody and, the questions that are in the chat box, etc. So, today we want to give you the most up-to-date information about where we are with Maryland COVID ready, especially as we head into the fall and colder months. We know that people will be indoors, closer contact, etc. And that we also have, as Donna introduced, the nurse consultant for us, and thank her for being here today, talking about the new COVID-19 bivariant boosters and et cetera for maximum, protection. And we all need to think about that and, take action on it also. We also have information on our waiver renewal, which is posted. And we want to ensure that you give us good feedback, which you always do. And we'll take that. And then also we want to update you on the guidance about where we are with Appendix K Flexibilities and unwinding. And obviously, we also want to be able to talk a little bit about the 3 fiscal management counseling services in our quality improvement partners. So, as always, our highest priority is everybody's health, safety, and well-being. And for our individuals and supports, our families, our staff, our providers, etc. So with that, we can go to the next slide, Donna, please. So direct support professional recognition, as it says on the slide, okay? So every year in September, we identify and work with a lot of folks to figure out who is going to be recognized as the direct support professionals during that week. And we do that with the rest of the nation. We're not the only state that does this. And, this is an opportunity for all of us to carve out time to honor these exceptional staff and people who, with our gratitude for everything they do in the DD community, not just in this one event, but all year long. And so, as we know that, and I've mentioned this in the past, that the DSPs are truly the backbone of our system. And without them, we can't get enough work done, accomplished, meet people's needs, what's identified for their dreams and wishes and their annual plans, etc. So we need to continue to thank them, not just in one event a year, but throughout the whole year for their hard work and dedication. Next slide. So this year, we We join other states, as I just said, about honoring individuals and raising the awareness. There might be a part of the population that doesn't understand what a direct support professional does in interacting with individuals and making sure that again, their dreams and wants and desires and identified in their annual plans come to fruition. So we obtained the proclamation from the governor to designate this extremely important week. We made a daily post on our Facebook and recognizing the work and the contributions of the folks who are DSPs. And we also participated with the Maryland Department of Disabilities in our annual event. And this year we've got about 28, we have 28 direct support professionals who've been nominated to receive awards. And it's just impossible to pick one or two winners. So, with such an amazing group of people, we're going to present all of these 28 individuals with a personal citation from the governor. We'll be doing that next week. I want to thank Secretary Beatty and the Maryland Department of Disabilities for partnering with us this year, and as we have in the past other years, in recognizing direct support professionals in this whole recognition week. Also related to the DSPs and our shared goal of enhancing the home and community-based services, the Center for Medicare and Medicaid Services recently approved our ARPA, as we call it, the American Rescue Plan request for one-time emergency, and that's going to be a retroactive 10% for a provider rate increase. And, we hope that all of these funds will be, or many of these funds will be, support and maintain a wage increase in other workforce recruitment and retention strategies, because we've heard about, when we went into the pandemic and people lost staff, and then trying to maintain staff, trying to bring staff back, that it's been a challenge. So we would hope that this 10% emergency retroactive money will help again with increasing wages, because we hear that all the time about, we need better wages. We know we compete with non-human services, areas that pay a little bit more than us at times. And so we need to continue to ensure that we can assist people who are either self-directing and or provider agencies in recruitment and retention. And again, I want to thank everybody for all that we do in our DDA community here. Next slide, please. So, as you know, October is National Disability Employment Month. And this year's theme is disability, part of the equity equation. And we recognize this vital role with people with disabilities have in making the workforce more inclusive. So this is great. We support meaningful employment for individuals, and that's one of our core values, unemployment. If you look on our website, and we've been dealing with the Employment First initiative for many years now, and it's going to be a first choice for our participants as they map out their chosen path for life. And as a person-centered system, we're committed to an equitable approach to help people with IDD as they want to have a good life and create a good life, and we need to assist folks to get that. And I wholeheartedly believe that the role of people with disabilities play in making the workforce stronger, more resilient, more diverse will be a benefit for everyone. People who are employed and the work that they do and the outcomes that they achieve. So over the next month, we'll be looking forward to reconvening the Employment First Leadership Committee, which we've had for a few years now, and we need to get back together again and take a look at the DD participants who are working in competitive integrated employment with their communities via a social media platform, et cetera. And again, I want to thank everybody who is attending today, who's also looked at our employment initiatives that we do with the Institute at UMass Boston ICI, and giving us data a couple of times a year so we have a sense of, are people getting, how much money are they getting, and how many hours are they working, et cetera, to see if we're getting any growth. And we have been. People are getting more money from year to year, more hours, and I think it's truly remarkable the work that everybody's doing. So again, with that, I'll stop there, and now I'm pleased to introduce Mikal Thornton. I hope I pronounced your name correctly, and that's what Donna introduced her early on as the nurse consultant for Center for Immunization, Prevention, and Health Promotion in our public health section of the department. So again, I want to thank her for joining us today and talk about information on COVID-19 and the bivalent booster. Thank you.
Thanks, Deputy Secretary Simons. I appreciate you all inviting me to present this information to your audience today. So good afternoon, everyone. As mentioned, my name is Mikal Thornton. I am the nurse consultant with the Maryland Center for Immunization. And we're just gonna provide you with some COVID-19 vaccine information updates. Next slide, please. So we're gonna kick off with some information that you need to know. So earlier this month, the FDA authorized and the CDC recommended 2 updated boosters. The newly authorized vaccines are the most current update to the original COVID-19 vaccine formulas. The new bivalent COVID-19 boosters target the original strain of the coronavirus and 2 Omicron subvariants, which have been identified as the most contagious versions of the coronavirus to date, and are predicted to continue circulating this fall and winter. Just like new flu vaccines are released every year to keep up with the rapidly adapting flu viruses, the new bivalent COVID-19 vaccine boosters are designed with the intent to be effective in preventing hospitalizations and deaths caused by the coronavirus and its 2 dominant subvariants. Next slide, please. So what are the bivalent booster dose requirements? So first, you have to make sure that you've completed your primary vaccine series. A primary vaccine series is defined as the vaccine administered as the first dose for a 1-dose series or the second dose for any 2-dose series. Currently, anyone 12 years of age and older who has completed at least a primary series is eligible for a bivalent booster, regardless of the number or type of prior booster doses received, so long as at least 2 months have passed since their last COVID-19 vaccine dose. One other important consideration is age. The Pfizer bivalent booster is authorized for people ages 12 and older, while the Moderna bivalent booster is currently authorized for people ages 18 and older. Next slide, please. So we have some frequently asked questions that we wanted to go over with you real quick. So is there a significant difference between the Pfizer and Moderna vaccines? No. The FDA has authorized and the CDC has updated clinical guidance on the use of the mix and match booster doses for currently available mRNA COVID-19 vaccines. And when I say mRNA COVID-19 vaccines, I'm specifically talking about the Pfizer and Moderna vaccines. The primary series while the same vaccine is recommended to complete a vaccine primary series, individuals have a little more flexibility with their booster doses. So an individual's bivalent booster dose may be different from what they received for their primary series. So unless an mRNA vaccine is contraindicated for a person, there's nothing wrong with receiving a Pfizer primary series and then switching to a Moderna booster or vice versa. The next question What are the side effects for the new bivalent COVID-19 booster? So the data is still rolling in, but experts say people can expect to have generally the same reaction to the new bivalent vaccines as they did with the first generation COVID-19 vaccine. So some common reactions include some pain, some tenderness or swelling or redness where the shot is administered. You may also experience some fever or fatigue, maybe some headache, maybe a headache, some chills, and body aches as well. Next slide, please. Are you still eligible for the new bivalent COVID-19 vaccine booster if you received a booster dose prior to September 1st when the bivalent booster doses became available? Yes. As I mentioned, anyone 12 years of age and older who's completed a primary series can receive the bivalent booster, regardless of the number or type of prior booster doses they've received. The key feature is that it should be 2 months have passed since the last COVID-19 vaccine. And the next question is, when might bivalent COVID-19 boosters be authorized for younger kids under age 12? Ooh, sorry. So currently, monovalent boosters are authorized for children 5 to 11, and they'll remain available to this age group until bivalent boosters are authorized and recommended. We do know that Pfizer has completed their submission to the FDA for emergency use authorization of their bivalent booster for children 5 through 11. And Moderna has also done the same for adolescents 12 to 17 and for children 6 to 11 years old. There are rumors circulating also that Moderna anticipates submitting an authorization application for an updated booster for infants and young children, so 6 months through 5 years old, sometime later this year. If bivalent booster doses are authorized for the younger population, it's quite possible that the current monovalent COVID-19 vaccines that are available for boosters will no longer be authorized. So please stay tuned for that information. As we receive more information, we'll be sure to provide the same. Next slide, please. And so if you have any questions, whether it's about bivalent boosters or about COVID in general, COVID vaccines, illness, whatever, you can send an email to us at mdh.covidvax@maryland.gov. And Maryland healthcare providers are encouraged to frequently check the Maryland Department of Health COVID-19 resource page, and the link is provided on the slide. Thank you.
Thank you, Donna. Can you go to the next slide, please? Hi, my name is Rhonda Workman. I'm the DDA Director of Federal Programs and Integrity, and I'm happy to join you today to share some updates on the waiver renewal, including the public comment period, the Appendix K extension and unwinding, and on self-direction. Next slide, please. In terms of the waiver renewal and public comment period, we would like to remind everyone that the department is seeking input on the DDA operated waiver programs renewal proposals. The comment period began on September 6th and will end on October 6th. Track change documents regarding our proposal for the amendments and the renewal are available on each waiver program's dedicated webpage, which is listed on our next slide. Public comment can be submitted directly to the dedicated DDA waiver feedback email address at wfb.dda@maryland.gov, or can be mailed directly to the DDA Federal Programs Unit at 201 West Preston Street, 4th floor, Baltimore, Maryland, 21201. To be considered for the input, all public comments must be submitted by 11:59 p.m. on October 6, 2022. Next slide, please. This slide includes the links to the dedicated web pages for the Family Supports Waiver community supports waiver, and community pathway waiver renewal proposals. Next slide, please. This slide includes the links to the stakeholder webinar conducted on September 1st that provided an overview. It also includes the presentation that was shared and a Spanish version that can be viewed, which is also posted on each of the renewal dedicated pages. Next slide, please. In terms of the Appendix K flexibilities, on September 19th, the department sent out communications related to updates to the DDA Appendix K flexibilities. The department worked with the DD Coalition for their recommendations on input into the Appendix K unwinding plan. If you have questions about the flexibilities being extended or terminated, please contact your DDA regional office. This slide includes a link to the Appendix K chart that provides that overview. Targeted flexibilities that have been extended to January 31st, 2023 relate to staffing ratios, hiring relatives and legally responsible individuals, provider increased rate related to isolation and other guidance that's noted on the website, services provided any day of the week and extend 8 hours per day and 40 hours per week within the person's authorized budget, suspension of the minimum number of hours for meaningful day services to be provided during a day. A provider may bill for the entirety day in PCIS2 only if the provider provided the person with at least 3 hours of cumulative supports. Next slide, please. Additional flexibilities include residential daytime shared service hours, training flexibilities, including effective September 30th, an exception for the training flexibilities would not apply if the previous training, like CPR or first aid, as examples, exceeds 18 months from the prior date or certification. And the flexibilities do not apply if the Office of Healthcare Quality, or OHCQ, has a finding that mandates a training requirement for a staff involved in an incident that resulted in a statement of deficiency or a plan of correction. As noted on this slide, the current guidance for these flexibilities that have been extended have been updated and posted on the DDA website related to Appendix K and the executive orders. Next slide, please. It is important for participants, with the support of their teams, to review these Appendix K staffing flexibilities and to also assess their current assessed needs for possible person-centered plan revisions. People self-directing and providers should continue to ensure that all staff meet the required service qualifications, including having current training such as CPR, first aid, and others by or before that January 31st, 2023 date. Next slide, please. I'd like to now share some updates related to self-directed services. Throughout the month of August, we sponsored a series of information fairs, both in person and via webinar, to introduce the department's new contracts with 3 financial management and counseling services, or what we refer to as FMCS agencies. They include GT Independence, Public Partnership, LLC, and the ARC of Central Chesapeake Region. These FMCS agencies will support DDA participants who currently self-direct their services or people who are considering adopting the self-directed service delivery model. During the information fairs, attendees had the opportunity to hear from each of our 3 new FMCS agencies and to attend the on-site face-to-face meetings to meet agency staff and ask questions to help them make an informed decision about choosing the right agency that works for them. This slide includes links to the recorded August virtual fair and a link to the dedicated DDA FMCS webpage that includes guidance and information associated with each FMCS fee. Next slide, please. The DDA and the new FMCS agencies will be conducting additional information fairs during the month of October, which are noted here and reflected on this slide. We have in-person sessions that include 2 Saturday and 2 virtual fairs. The virtual fairs will be held via webinar on Wednesday, October 5th, and Monday, October 25th at noon and 5 p.m. The in-person events will be held throughout the regions, starting on the Eastern Shore in Salisbury on Tuesday, October 11th, in Frederick on Thursday, October 13th, in Rockville on Saturday, October 15th, and in Randallstown on Saturday, October 22nd. When registering for an event, please also let us know if you need any special accommodations so that we can support your needs and have that ready prior to the event. Next slide, please. In terms of criminal background checks are required for self-directed staff as noted in the approved waiver application, FMCS contract requirements, and DDA guidance. A new background check must be completed for all new employees, even those who may have had a similar one run for another reason or another program like the autism waiver. The background check requirements applies to all services as listed in the waivers, including support brokers. The FMCS will pay for all background checks for employees. Each FMCS will have a process for this, and it's important to reach out to them for more details. The FMCS will not pay for background checks for vendors. Background checks are part of doing business as a vendor, and it is the vendor's responsibility to ensure that they have that background check and provide it upon request. Next slide, please. The DDA announced this week that current employees of participants self-directing services prior to the transition to the new FMCS services, regardless of that transition date, would have until December 1st, 2022 to meet the criminal background check requirements. Today, we are announcing an update to this guidance as follows. All current and new employees will have until February 1st, 2023 to meet the state fingerprint criminal background check. FMCSs will conduct private background checks while coordinating the program's required fingerprinting background checks prior to February 1st, 2023. This is new information and guidance has been issued today to the FMCSs and is being shared with you today during the webinar. Finally, I would like to share that we have received some questions regarding verifications for employees' high school diploma or GED. We have also shared today guidance with the FMCSs that an attestation from the employee will meet these requirements. FMCS agencies will be following up with individuals that this applies to. Now, we'd like to turn it over to our guest speaker, Jennifer Mettrick, Executive Director of the Maryland DDA QIO from Liberty Healthcare. Next slide, please.
Thank you, Rhonda. Welcome everybody. I'm Jennifer Mettrick from Liberty Healthcare, and I'm going to provide a quick update today around the operations and the next steps for the Quality Improvement Organization. Next slide, please. As we discussed at last month's webinar on August 26th, the QIO has 3 core functions to support DDA's efforts to create a person-centered flexible service delivery system. Most importantly, the QIO will be interviewing people receiving services and their families to ensure that their voice is heard and their experiences are shared as part of our data collection processes. The QIO also will be discovering ways to improve services and supports through a series of evaluations of the quality of service delivery. And finally, we'll be pulling all of the data collected through that discovery process together for analysis to identify trends and identify opportunities for improvement. Next slide. So as we discussed also last time at the webinar, the 3 areas in which we'll be focused our evaluations on are around monitoring of the basic waiver assurances through CMS. We'll be looking at the National Core Indicator survey collection and be able to talk with adult consumers as part of the interviewing process, as well as being able to survey families and family guardians as part of the process. And then finally, we'll be supporting the data collection efforts of the Council for Quality and Leadership's network accreditation for the state of Maryland. And so just to give you a quick overview of the things that have been happening in the last month and what to expect in the coming months, we have developed a QIO collaborative work group. The members of that work group have received invitations this week, and we'll be getting out the finalized list for the collaborative work group next week. We had over 80 people that requested to participate in the collaborative, but we only had 25 opportunities for participants to be representatives on the collaborative work group. And so those stakeholders that were chosen were those representing self-advocates, family members, coordinators of community service organizations, provider organizations, as well as other statewide advocacy organizations. The meetings for the collaboratives will be happening on the 3rd Thursday of each month from 8:30 to 10 a.m. And again, we will be providing a full list of the participants on the collaborative work group so that folks can make sure that if they have any feedback or information to share, they can share it with the representatives of the collaborative. We also will be launching the National Core Indicator Adult Consumer In-Person Surveys and the Family Mailed Surveys in the first week of November. So we are really excited to begin to collect information directly from waiver participants and their families. And we encourage everybody, if there are questions that arise around the National Core Indicator surveys, making sure that we're really talking that up and people know that this is a great opportunity for them to share their experiences and their satisfaction with services. And then finally, as part of the CQL network accreditation, the leadership from CQL will be providing an overview webinar on November 3rd, 2022. And we will be sending out an invitation for that and all of the information to sign up for that webinar in the coming weeks. But we wanted to make sure you had that save the date. And those are the updates for the QIO. Go to the next slide.
So obviously this slide shows the link, and please share this with your colleagues, families, people who are in supports, etc. After you register for the webinar, you're going to get an email confirmation. And I just want to thank everybody. We've had a good turnout today, and for posting your questions. And, you know, again, I look forward to your value. I value your feedback and you know, the way you can interact with DDA and help us to become and stay responsive to everybody's needs. So please stay healthy and safe. And again, I look forward to our next webinar on, I think it's October 28th. And with that, I think we are on to questions.
Good afternoon. This is Dr. Smalls. I want to first thank all the presenters for the important information that was shared. Thank you, Deputy Simons, for your introduction, and welcome to our whole team. Some of you have asked some really good questions regarding the ARPA funds, which will be answered in future FAQs. If you have bivalent booster, vaccine, or other COVID-related questions, you'll be able to send those questions directly to the address indicated in today's presentation, and you'll be able to download this entire PowerPoint as a handout. It should already be in your handout section to the right of your screen in your webinar. We will start to move through some of the questions that you have provided us, and there are quite a few. So we apologize in advance that we may not be able to hit all of them, but we'll try to get through as many as we possibly can. Okay. Our first question is going to go to Rhonda. Rhonda, does the Appendix K 18-month flexibility apply to the support broker certification as well?
Yes, in terms of the staffing flexibilities that have been extended, they've been extended unless the certification or training is 18 months, is older than 18 months. In that case, it would need to be provided.
Okay. Are educational transcripts now required for self-directed DSPs?
So I would need a little bit more information related to the question, but in general, I would state that for some services noted in the approved waiver programs, it requires the employee to have a high school diploma or a GED. As I announced today, an attestation that the person meets those requirements will be acceptable, in addition to documentation that they may provide demonstrating that they have met that. That's the follow-up that the FMCSs will be checking in with the individual. Again, the option is an attestation from the person or documentation to support it.
Thank you. A couple of these are going to come straight to you, Rhonda, so bear with me here. Can you share the providers who will be part of the work group? That's actually a QIO question. Jennifer, do you mind taking that?
Yes, we'll be publishing that list on the QIO page of the DDA website on Monday.
Thank you. Okay, our next question. How many family members are in the collaborative work group? What criteria was used to choose who would be part of that group, Jennifer?
I believe there are 4 representatives from families or family organizations that are part of the collaborative work group. We were looking to make sure that there was as evenly distributed representation from the 4 regions, as well as representation of families, self-advocates, providers, and other types of advocacy organizations.
Thank you. Rhonda, for the background checks and fingerprinting, can support workers get on the background check completed list and provide a direct copy to the 3 FMCSs?
Yeah, thank you for that question. The FMCS will have registered with the Criminal Justice Information System so that that background information is submitted directly to them so that they have the actual source document. The criminal background checks will also provide any updates to any potential upcoming situations that may occur, so that if a situation changes for an employee, the FMCS would get an alert or an update on that background check. Therefore, it needs to be completed as per the FMCS's guidance, so that we ensure that they have the information from the original source, in addition to have any updates that may be provided.
Thank you. This looks like a repeat, but it looks like good information to repeat. Could you please, Rhonda, provide the date for the criminal background checks, the new date?
Sure, absolutely. So again, today we are announcing, and have also just today shared with the FMCSs, the extension for the fingerprinting criminal justice information system background checks to February 1st, 2023. That will apply to all current employees and new employees, and the FMCSs will conduct a minimum private check while they're coordinating with employees and new employees to meet that requirement by February 1st, 2023.
Okay, thank you. Another question for you, Rhonda. Has there been clarification on the retainer days? Will there now be 18 days for October through December 31st and then start over again in January?
Yeah, that's a great question. And so as previous guidance that we've shared, we are working with the department and Medicaid to have that federally approved from CMS to be able to end the residential retainer days with that effective September 30th date. And then once we get confirmation from CMS approval on that, we can provide notice that the waiver residential retainer fees of 18 days could be used. So again, once we get approval from CMS, we'll let you know, as per guidance that had been previously issued, that talks about how you can code the C days versus the V days in PCIS. That will help to alert us to the differences that we can take action on after CMS approval.
Thank you. Another one for you, Rhonda. Are the residential shared hours continuing permanently as stated on the Appendix K?
It's a great question. And so in the Appendix K chart, there's an asterisk after a few of those provisions and flexibilities. So the Appendix K flexibility, where the DDA added 8 hours or more for a group home to provide daytime supports when the public health emergency occurred and we were all mandated to stay home. That's the flexibility that will be ending January 31st, 2023. However, we note that there are some individuals that are authorized daytime residential supports in their home. Sometimes in the past it was referred to as in lieu of day. So based on their assessed need, some individuals may have that authorized in their PCP outside the Appendix K flexibility.
Thank you. do we have to, Rhonda, this is for you, do we have to choose a new FMS prior to making budget changes or to access the HRST screening tool?
Can you share that one more time? Say it again.
Do we need to choose a new FMS prior to making budget changes? Let's do that part first.
You do not need to choose a new FMCS prior to making budget changes. Currently, you must make a selection and choice by November 15th to either change your FMCS by October 1st, which has already passed, the opportunity to do that coordination, or January 1st. So if you selected an FMCS with an effective date of January 1st, and you need to do a budget modification, you can conduct that now and do not have to wait until January 1st.
Okay, and I think the second part of that was just kind of the same. Do you need to decide who your new FMS will be prior to being able to complete that HRST screening tool?
So no, the FMS is, there's a process in place to ensure access to HRST. And then when you choose your new FMCS, if it's a different FMCS than you're using, they will also be able to provide that access. So you don't have to do that. If you're a current employee or current participant, you should have access to that.
Okay, great. Rhonda, another one for you. What agency or company will be performing these fingerprints?
Yeah, the Criminal Justice Information System is completing the fingerprints. It's the Maryland State Department. I'll get the name and share it in a minute.
Okay. There's another fingerprinting question. I know you're looking that up. If I've done a background check with my DDA agency, can that one be used for self-direction services as well?
That's a good question. The answer is no. As I previously shared, the FMCS agency will have an account with the CJIS system so that they can get the information from the source document, the original source document directly, and then they will get updated information.
Thank you. Rhonda, it's another one for you. Can you provide clarification as to whether DDA is accepting application for support broker agencies referenced in the DDA waiver renewal?
The DDA is always seeking new providers, vendors, support brokers to support individuals and families in our service delivery system. So support brokers would need to complete the DDA required support broker training. And if you have questions or you're interested in becoming a support broker or support broker agency, I encourage you to reach out to our regional office self-directed leads or Christy Colbreth. And then Yamanja, just in response to the other question, as per noted in the guidance that we had sent out earlier this week on the 27th, it's the Maryland Department of Public Safety Criminal Justice Information System.
Thank you. And we've got quite a few questions that are coming in. Some of them are repeats, but we're trying to get, trying to make sure that we're capturing the gist of your concerns. Let's see, got a few more coming in here. Rhonda, it's another one for you. When does EVV begin, and are all of the services included?
Yeah, that's a great question. So in terms of self-direction, EVV, which stands for the Electronic Visit Verification, that's required by the federal government under the Cures Act, We'll begin for people self-directing services for only 2 services. That includes personal supports and respite care. And that requirement will begin January 1, 2023.
Thank you. Here's another fingerprint question. If I got fingerprinted recently, does that count for staff? Let's see. I'm assuming that just means if I've already gotten fingerprinted, can I use that
So
updated one?
Yeah, it's a great question. Each individual situation will differ. And so my advice would be to follow up with the FMCS agency to ensure that they have the information that they need as required by the department to ensure that.
Great. And there are a few other ones that are a little bit more lengthy and give some specific information, and I'm not going to read those right now, but I want to strongly recommend that if you have questions, I know it's a lot of information, that you continue to submit those. As we mentioned earlier, there is a link in the PowerPoint where you can direct some of your questions as relevant to the COVID and vaccine and bivalent. And if you have any additional questions on ARPA, again, we will be providing an FAQ following. Again, thank you so much for your questions. Apologize that we aren't able to hit all of them, but it is important to hear from you, and it helps us to refine the information that we provide out. That's the end of our question session. I'm going to hand it back over to Donna. Thank you.
I think we're going to end the webinar. Is that correct?
Yeah, this is Bernie. If we have no questions, again, I want to thank everybody for attending today. We had almost 500 people in attendance, so this was really outstanding, and I wish everybody a healthy and happy weekend. Thank you.